everyone. Bonjour à toutes. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Sébastien Tremblay, and I will be your moderator. Je m'appelle Sébastien Tremblay et je serai le modérateur de ce point de presse. Before we begin, a reminder to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Today, we will be hearing remarks from le Maire, Jim Watson, followed by Anthony DeMonte, General Manager of Emergency and Protective Services, Directeur Général des Services de Protection et d'Urgence, and la Dr. Vera Etches, Chief Medical Officer of Health, Médecin-Chef en Santé Publique. Available for questions from the media following the statements, we also have, disponible pour répondre aux questions des médias, nous accueillons aussi Dr. Trevor Arneson, Associate Medical Officer of Health at Ottawa Public Health, médecin adjoint en santé publique Ottawa. After we hear from the panelists, we will take questions from the media. We will begin now with remarks by Mayor Jim Watson.
Great, thank you very much, Sébastien. Merci beaucoup, Sébastien, et merci à tous pour votre participation aujourd'hui. Thank you for participating in our regular news conference. This morning, I received my first dose of vaccine at the Nepean Sportsplex, and I've heard from a number of people who've already received their first dose, and they tell me some of the feelings that they were experiencing: excitement, relief, happiness, and I can attest to all of those when Caitlin, a great nurse at OPH, jabbed me, and aside from a minor little pain, I feel great. Je suis certainement très soulagé d'avoir reçu ma première dose aujourd'hui à la Sportsplex de Nepean. I went through the same process that all residents would go through when they go to get their vaccine at one of the city's community centers. I've been regularly hearing from residents after their appointment about the great experiences they've had at these mass vaccination centers, and I can certainly vouch for that today. From checking in to actually receiving my vaccine to the checking out process, it was very smooth, and I always felt at ease. And I want to take this opportunity to recognize the staff working at the Sportsplex, as well as the other city staff working at all the city's vaccination locations, including our pop-up sites and our high-priority neighborhood communities, for the tremendous work that you are all doing. In particular, as I mentioned, I want to thank the nurse who gave me my shot from OPH, Caitlin, who did a wonderful job, and I barely felt it when the needle went in the arm. Every vaccine delivered, of course, brings us one step closer to community immunity, and I want to thank all of those who have made this moment possible, as well as those of you who have gotten their vaccine or signed up to get one. As Dr. Etches and many other health professionals have said time and time again, the best vaccine is the one that you can get first. Very simple message, and we encourage you to follow that sage advice. The fact that I've been vaccinated won't change how I approach my day-to-day activities. We're still not out of the woods, obviously. Even if we have, in my case, one vaccine, we need to get more people vaccinated with their first dose, and then, of course, get more and more people vaccinated with their second doses. So I'll continue to follow public health guidelines, and asking all those who have received their vaccine, please don't have this sense of false security. You're still at potential risk of contracting COVID-19. That's why it's important to get the vaccine, then wait your turn, and then get the second vaccine. But in the interim, please continue to wash your hands, wear a mask, practice social distancing. It's certainly been a long haul since COVID-19 first arrived in Ottawa in March of last year. And as we see more and more residents getting vaccinated, I think that hope in us starts to get a little stronger. The hope that we soon might be able to get back to some sense of normalcy, perhaps in the late summer and early fall. But we are making very good progress on the vaccination rollout right here in the city of Ottawa. To date, 41% of residents in Ottawa 18 and older who have received at least one dose of COVID-19 vaccine. We recently surpassed two important milestones in vaccination coverage. The first is that over 79% of residents ages 60 to 69 have received their first dose, and 50% of residents in the age group 50 to 59 have received their first dose. We expect our numbers to jump substantially tomorrow, with further groups becoming eligible. I encourage everyone to continue to book their vaccination appointments as their eligibility age comes up. I know this requires patience, but I can assure you that we are working very hard to get a first dose to everyone who wants the vaccine as soon as possible. Je sais que cela demande de la patience, mais je peux vous assurer que nous travaillons très fort pour obtenir une première dose à tous ceux et celles qui veulent un vaccin dès que possible. I think seeing movement in the vaccine front is also helping people on a mental health level too. And May 3rd to 9th is Mental Health Week in Ottawa and throughout the country. Always an important week where you can check in with yourself as well as your family and friends and take the time to assess how you're doing. We've all heard this many times. The past 14 months living through this pandemic has been exceptionally challenging for all of us. We miss seeing our family and our friends and our coworkers. We miss going to work and going to school. And we miss going out to do the things we used to take for granted, going to a restaurant, going to the gym or an activity, play soccer, or go and see a movie. It's normal to be experiencing a range of emotions and feelings, whether that's sadness, anxiety, anger, stress, or fear. In my case, it's boredom. I think I've watched every Rambo movie at least 3 times in the last couple of weeks. I wish Netflix would have more movie choices on when I'm at home. But the bottom line is it's okay not to be feeling okay. C'est correct de ne pas de sentir bien. Throughout Mental Health Week and at all times, we're encouraged to talk about these feelings and know that we aren't alone. We have some great resources and can help, including the Distress Center of Ottawa and region, a 24/7 local connection to mental health support and resources, as well as Kids Help Phone for our younger residents. Please reach out if you do need assistance. In addition, I was recently approached by Unsafe at Home Ottawa, who raised the important issue of violence against women and gender-based violence. I want to reiterate today that leaving a violent relationship to get to safety is an essential reason to leave home. You can access their 24/7 support line by calling 613-745-4818. That once again is 613-745-4818 for English residents. Et 613-745-3665. Ça, c'est 613-745-3665 pour des résidents francophones. And also you can text 613-704-5535 or visit unsafeatottawa.ca, unsafeathomeottawa.ca for more information. So the text number is 613-704-5535. And their website is unsafeathomeottawa.ca. My thanks to our community partners for providing these critical services in our community. Finally, I want to recognize that it's Mother's Day coming up on Sunday, a day where we thank the mothers in our lives for all they do for us. And although we might not be able to see our moms in person this year, I encourage you to reach out over the phone or on a video chat to check in with your mother. I want to take this opportunity to thank again all of our colleagues in the public health and paramedics and city employees and the not-for-profit sector, the hospitals, so many groups that have come together working literally around the clock to fight this virus. Alors, merci, and I look forward to hearing from Dr. Etches and Tony DeMonte and taking your questions. Thank you. Merci.
Thank you, Mayor Watson. We will now hear from Anthony DeMonte.
Thank you very much, and good afternoon. Bon après-midi. Earlier this week, the province lowered the age limit for individuals living in one of the 3 provincially defined hotspots that have postal codes beginning with K1T, K1V, or K2V. Residents age 18 and over living in one of these areas can now book an appointment through the provincial booking system at one of the city's community clinics. I'm pleased to advise that around 17,000 people booked appointments at our clinics in the first 24 hours after residents in these areas became eligible. To help provide better access to these residents, the City and Ottawa Public Health are opening an additional temporary clinic at the Infinity Convention Centre over the weekend, starting on May 8th. Dans le but d'offrir un meilleur accès aux résidents dans ces zones, la Ville et la Santé publique Ottawa ouvriront cette fin de semaine, soit le 8 mai, une nouvelle clinique temporaire au Centre de Congrès Infinity. The location of this clinic is key. It is in some of the neighborhoods hardest hit by COVID-19, including the two provincially identified hotspots of K1T and K1V. In addition to the launch of this clinic, this week, we are piloting drop-in vaccine clinics for residents 18 and over living in priority neighborhoods that were previously identified by Ottawa Public Health. Two of the clinics have already taken place and were both a great success. Dans ces deux cliniques, on a déjà ouvert et ont eu connu un succès franc. Ottawa Public Health worked tirelessly to make these pop-ups happen. Je tiens à remercier le personnel de la santé publique et la Ville d'Ottawa qui a travaillé acharné pour que ces cliniques soient déployées. The priority neighborhoods are the greatest risk of being impacted by COVID-19, so we know there's more that we need to do to help these areas. To make it easier for residents living in these areas, these clinics are drop-in only. No appointments are required. Appointments are provided on the spot. C'est donc pour faciliter l'accès des résidents de ces zones chaudes que nous avons mis sur pied des cliniques sans rendez-vous. Les rendez-vous sont donnés sur place. This is one of the ways to help make sure that all residents have access to the vaccines, which is critical as we fight this virus across our city. And we will continue to work with Ottawa Public Health to try to find new ways to reach these residents. We're also working with our community health centers and community housing partners to visit residential buildings in priority neighborhoods. We are going door to door and floor to floor, vaccinating residents right where they live. We know that we still have a long way to go, but we are confident that these measures will help reduce barriers for the most impacted community, and we will help build on our community immunity. We also continue to see the eligibility increase for our residents. Et de plus en plus, les résidents deviennent admissibles. Starting tomorrow, all Ottawa's residents aged 50 and over can begin booking appointments to receive COVID-19 vaccine at community clinics. I'm also pleased that some of our essential workers who can't work from home will be able to book their appointments through the provincial system as well starting tomorrow. This includes staff in elementary and secondary schools, workers who respond to critical events, enforcement, inspection, and compliance workers, and people who work in licensed care settings, agricultural farmers and farm workers, as those in food manufacturing and distribution, and other workers identified as Group 1. All of these essential workers remain front. Tous ces travailleurs essentiels demeurent au fond chaque jour pour nous aider, pour aider notre ville plutôt. Et merci. I can tell you how pleased we are to be able to give you your vaccination. Also starting tomorrow, those with the highest risk and high-risk health conditions will be eligible to book on the provincial system. We know that many of these residents have been very concerned as to when they will be able to receive their first dose, so this is a significant step forward. And you can find the definitions of these health conditions on ottawapublichealth.ca. For everyone who's planning to book tomorrow, you should know that we currently have more than 60,000 open appointments until the end of the month. Si vous envisagez prendre rendez-vous demain, sachez qu'il y a actuellement plus de 60 000 plages disponibles jusqu'à la fin du mois. And more will be added in June as soon as we can receive confirmation from the province how many more doses we will receive. As Mayor Watson mentioned earlier, 41% of eligible residents have received at least one dose of the COVID-19 vaccine. To date, more than 391,000 doses have been administered in Ottawa. And we are expecting that starting in late May, vaccine supply will increase and the province will significantly expand eligibility, with individuals aged 18 and over eligible to book through the provincial booking system as early as the week of May 24th. As a result, our team is preparing to ramp up clinics and delivery tactics accordingly. Dans ce contexte, notre équipe se prépare à multiplier les cliniques et s'adapter à la stratégie de distribution. We want to remind Ottawa residents who become eligible to book their vaccine that it could take some time for them to receive an appointment. And we understand this is frustrating as many residents want this vaccine as soon as possible. As more vaccine supply is confirmed, additional appointments will be added to the system. Residents of all ages who are not yet eligible for the vaccine are encouraged to sign up for the City of Ottawa's COVID-19 vaccine update email subscription, where the latest news will be emailed to you. You can also find it on ottawa.ca and ottawapublichealth.ca. You can also find the latest news on these websites, as well as our social media channels and from our local news media. Again, we want to reassure you that everyone who wants a vaccine will be provided one and have the opportunity to get one. Finally, as General Manager of Emergency and Protective Services, I would be remiss if I did not recognize that this is Emergency Preparedness Week. Enfin, en tant que Directeur Général des Services de Protection et d'Urgence, je dois souligner la Semaine de la Sécurité Civile. I want to acknowledge the tireless efforts of city staff who work day in, day out to prepare for, respond to, and recover from life-threatening emergencies, often unexpected, and even who've been working in our EOC throughout the COVID-19 emergency. We know the entire world has been in a state of emergency for more than a year now. However, we still need to be prepared for other types of emergencies, such as power outages, tornadoes, blizzards, and floods. Toutefois, nous devons toujours être prêts à répondre à d'autres situations d'urgence, comme les pannes d'électricité, les tornades, les blizzards et les inondations. That's why the city is designing a community emergency preparedness toolkit to help community groups prepare and respond to emergencies. I'd like to take this opportunity today to invite all residents to visit and engage on ottawa.ca this week to review the toolkit and offer your feedback. I also invite all residents to follow the city's social media channels to find out more information this week about the importance of communication during an emergency. Thank you very much. Merci beaucoup.
Thank you, Mr. DeMonte. We will now hear remarks from Dr. Vera Etches.
Thank you. And it is excellent to see the number of populations eligible for vaccination increasing and the interest from people, recognition of the importance of immunization. And so it is true, as more and more people receive their vaccine, they're eligible to book, supplies going up, we are going to move closer and closer to community immunity. And so today, Ottawa Public Health and the city have launched a new campaign to continue to address any unanswered questions and promote awareness of vaccines. There are resources now that we have people can share with their friends and family, really address the questions of why you should get a vaccine, what you can do while you wait for your vaccine to get ready, and then what you can do after you receive it. So we are getting closer every day, but it will take some time to reach community immunity. As the mayor said, thank you, Mayor, we do need to continue to follow public health measures, like getting tested if you show symptoms, staying home when you're sick, washing your hands, wearing a mask, maintaining physical distancing until everyone has that protection from the vaccine. So aujourd'hui, Santé publique Ottawa et la ville ont lancé une nouvelle campagne sur l'immunité des communautés pour amplifier la sensibilisation au vaccin contre la COVID-19. Et cette campagne inclut diverses ressources, des outils pour guider les conversations avec vos proches, de l'information sur les bienfaits du vaccin et ce que vous pouvez faire en attendant, le vôtre et quoi faire après l'avoir reçu. À mesure que plus de personnes reçoivent leur vaccin, deviennent éligibles et que l'offre de vaccins augmente, nous nous rapprochons de l'immunité de communauté. Et d'ici là, nous devons continuer à suivre les mesures de santé publique qui nous protègent de la COVID-19 et de ses variantes. So visit ottawapublichealth.ca/community immunity for more information on this campaign and how you can spread the word. And I recognize information on vaccines is constantly evolving. We learn more as the vaccines are used in the real world. It's a dynamic process, and we're going to continue to use multiple channels to communicate as clearly as we can with you about when it's your turn, where you can be vaccinated. So please continue to check the websites, as Mr. De Monte said. And my advice to you has been and continues to be to take the first vaccine that is made available to you. All vaccines in Canada currently in use are approved by Health Canada. They're safe and effective against COVID-19 infection, against serious illness and hospitalization. And the benefits of all the vaccines outweigh the risks of COVID-19. Ma recommandation aux Ottaviens a été et continue d'être de prendre le premier vaccin mis à votre disposition. Tous les vaccins utilisés au Canada ont été approuvés par Santé Canada et sont sûrs et efficaces contre l'infection de la COVID-19, les maladies graves et l'hospitalisation. Les avantages de tous les vaccins l'emportent sur les risques associés du virus. So if you're still unsure, know that informed consent and having open and inclusive conversations about vaccines are an important component of increasing vaccine confidence. So talk about your options with your healthcare provider. When it comes to our indicators of COVID in the community, we continue to see a slow decline in the number of people testing positive for COVID-19 and in the percent positivity rate. We have also seen the numbers of people going for testing reducing in recent weeks. And this is likely due to a number of factors, including less COVID, the stay-at-home order. I do want to continue to encourage people to be tested if you have symptoms of COVID. It allows us to get a more accurate idea of what's happening in the community. And most importantly, it allows us to support you when you do test positive and to provide you with important information about isolation, contact tracing, and to advise on when medical attention is needed. Sometimes people are having severe illness and they don't realize it can escalate quickly. Please do make sure if you are struggling, you're finding that you're not having the usual kind of cold symptoms that resolve, that you do seek further medical attention. Our website also continues to let people know where they can be tested and what hours of operation exist across the different sites. So this week is Mental Health Week, and everyone knows these are challenging times, but really to underline that feeling worried or lonely is natural. Good mental health doesn't mean you're going to feel happy all the time. And so this year, the theme for Mental Health Week is to get real, to name and express and deal with our emotions, even the uncomfortable ones. Heavy feelings become lighter when we put them into words, and something I'm trying to teach my children. This week and every week, I encourage you to reach out and have that talk about mental health and mental health challenges with a friend, a colleague, or a trusted mental health professional, like our friends at the Distress Center or a local counselor. Nous vivons des moments difficiles et se sentir inquiète ou seul est naturel. En cette semaine de la santé mentale et chaque semaine, je vous encourage de parler pour vrai de votre santé mentale avec un ami en confiance, une collègue ou un professionnel de la santé comme ceux du Centre de détresse d'Ottawa. And again, mental health resources can be found online at ottawapublichealth.ca/COVID mental health. And for many, one of the most challenging times of this pandemic, or parts of this pandemic, has been our inability to visit our loved ones in person. We miss the hugs, the sharing the meals, the sitting close together and catching up. So the friends and relatives across town feel like they're even across the country. We will get to a point when in-person visits will be possible. not quite there yet. We want to really benefit from driving the levels down and giving the vaccines time to work. So this Mother's Day, I do encourage you to participate virtually, celebrate virtually. Even if your mother or your grandmother has been vaccinated, we want to continue those behaviors that will keep COVID transmission as low as possible until more people are protected from the vaccine. So stick with your household, continue to find special and creative ways to tell someone that you love them from a distance. Et pour la fête des mères, je vous encourage à célébrer virtuellement. Même si maman ou grand-maman a été vaccinée, devons tous rester avec les gens de notre domicile et continuer à maintenir les comportements qui réduisent le risque de transmettre la COVID-19 jusqu'à ce que plus de personnes soient protégées avec le vaccin. So community immunity is about more than vaccines. It's about working together to do everything we can to protect each other. Thank you. Merci, Miigwech.
Thank you, Dr. Etches. I will now invite questions from each agency alphabetically. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Vous pouvez poser une question et une question de suivi. Again, a reminder to remain on mute until I invite you to ask your question. We'll now start with Matthew Kupfer at CBC Ottawa.
Hello, everyone. Can you hear me?
We sure can. Go
please
ahead.
tell me you can hear me. Okay, thank God. Well, first, I just wanted to ask about, I guess, as you were mentioning, the vaccine supply is increasing. The city OPH efforts are trying to expand to meet that supply. But we've also seen a news release from the Ontario government that they'll be putting more Moderna doses in pharmacies. And I guess I'm wondering, you have this system, you have all of these people in place, these locations that were in place for the city and public health run vaccination campaign. And of course, we've seen people struggling to deal with the multiple terminals of the pharmacy system. So I was hoping you could respond about whether, the city was hoping that it would be getting more Moderna shipments. Or I guess how much of your capacity, your ability to ramp up is kind of being left to the side, if these Moderna shipments are being directed to the pharmacies, as the province recently announced.
I'm happy to speak first, Tony, but we need every channel. It is complex, absolutely. I know there have been challenges with people trying to get access to a pharmacy, but getting more Moderna to pharmacies allows the pharmacies to continue that channel as one way people can access vaccine, hopefully in their neighborhood, as they, the longer term plan is to continue to bring on more pharmacies across the city as supply allows. So I'll let Mr. Dimonte speak to what's happening with our supply and our clinics, but just with primary care providers as well, we're trying to use every channel to give people choice of place of access and to be able to vaccinate as many people each day as we can.
I would just add as well to what Dr. Etch has said. So absolutely, multiple channels is great. It's not in competition actually with us. On the contrary, we will also be receiving more Moderna, so that's positive. And in fairness, also because AstraZeneca was the primary vaccine that was given to pharmacies, and there's some delay now in some AstraZeneca. This is a way to fulfill that delay, so those channels won't be delayed, and those opportunities are available to people. And as Dr. Etch said, it's important that you can go to your local pharmacy. It's much more practical, and for some people too. So all these channels are very positive. So for me, it's positive news as well.
En français, s'il vous plaît, Monsieur Dimonte.
Donc, le gouvernement de l'Ontario indique que Moderna va être aussi disponible dans les pharmacies. C'est pas une compétition avec nous. On va aussi recevoir de Moderna en termes de vaccins supplémentaires également, donc pas en compétition. Et comme le docteur Etches a indiqué tantôt, je suis entièrement d'accord avec elle, toutes les modalités pour obtenir un vaccin sont bons. Donc, on fait des modalités dans les gens au risque. On s'en va de domicile à domicile dans les gens au risque. les pharmacies, les cabinets médicaux, ainsi que nos cliniques. Donc, ça fait partie d'un ensemble d'activités qui visent à augmenter la vaccination dans la population. Donc, je vois l'ensemble de ces décisions-là positives.
Matthew, your second question?
Yeah, so I guess you've been talking somewhat about community immunity. Right now, the percentages that we're getting of the population are all in terms of eligible residents. Health Canada has approved the Pfizer vaccine for children between the ages of 12 and 15. I guess I'm wondering what that expansion towards younger age groups might mean for this notion of community immunity, as you were calling it, and if there are kind of, I guess, if you have mechanisms in mind for how you're going to get to, it seems like a younger and younger population who may now be eligible for the vaccine. I guess with the world of eligible residents expanding.
Thank you. I think just there are a few questions in there. Maybe just to say it's good news. It's good news that Pfizer's been approved for younger age groups, people 12 and above now. And the way that will proceed to lead to immunization of younger people in Ontario would be, first of all, a provincial decision about that mechanism, how this age group would be added into the provincial program. And then locally, we've actually already, I think, been having conversations with children's healthcare providers to talk about the best way, and also with schools. Potentially school-based immunization is one of the ways public health traditionally immunizes people in this age category. And maybe Dr. Arneson is our public health lead for medical advice around the immunization program and approaches. So I invite him to say more. But so far, it's been outstanding, the response of people in Ottawa to be vaccinated when it's their turn. We've reached over 80% of people in each age group as we go down that are coming forward to be immunized. So I expect that trend to continue.
Yeah, so I'll just add, when we're talking about community immunity, of course, if you have a huge age group that is still susceptible, as we know they are, it's much harder to achieve a level where it's not circulating. So this is good news from that front. And I'll go one step further than what Vera said, but this is right in our wheelhouse of expertise. We're immunizing teenagers through school-based programs is the primary way that public health delivers vaccination in a non-pandemic year. So we're very well prepared for it, and we're also working with the hospital at CHEO and their Kids Come First partnership, very prepared and excited to partner to make sure that we get this cohort of adolescents vaccinated efficiently.
Thank you, everyone. We will now move on to Eric O'Brien at City News.
Hi, everyone. Sorry, my question's here somewhere. All right, so maybe starting off with Dr. Etches. Just out of my curiosity, when do we know, when was the first case of the Indian variant confirmed in Ottawa? And at the same time, how many cases have we had in the city since?
So I think there was posting on our website 3 confirmed situations where a COVID test has come back as a variant of the type you're referring to from India. That is it. That's all I'm aware of in the community right now. We did learn about these after people had completed their quarantine. And we know that they followed all the directions. I believe 2 out of the 3 in Ottawa. The other third person is actually not currently in Ottawa, is I believe in the GTA. So the the follow-up with those 2 people confirmed that they followed the quarantine. And I also believe their close contacts, out of an abundance of precaution, went for testing as well and have come back negative. So that's all we're aware of at this point in time. They were all travel related too, I think it's important to say. So that's why I'm saying they completed the quarantine, upon return to Canada.
How concerning is it? How just in general, how concerning is it for the B1617 variant to be in the city? Are the measures sufficient enough to gain control of it, or sorry for the lack of better terms, or are all of our eggs in the vaccine basket?
The public health measures that prevent transmission of COVID work for variants. So it's spread the same way through respiratory droplets and small aerosols if there's prolonged close contact, especially indoors. So be outside, keep your distance, wear a mask. Those will protect against transmission of all the variants of concern. We know the situation in India is really tragic and hard to see. We're still learning about this variant in particular. We don't know all that much about its severity or if it's a greater degree of transmissibility. But we'll continue to do the monitoring of people who test positive to see what variants are here and see what their effect is. So the public health measures are important. The stay-at-home order is important, and then gives us time for that vaccine protection. So we have mostly the variant of concern in Ottawa is the B117, and that one we know the vaccines will help to limit its transmission in the community, and we'll continue to evaluate.
Thank you.
Thank you. We will now move on to Josh Pringle with CTV Ottawa.
Good afternoon. I'm not sure who my first question is for, but on the communications plan for informing residents about the COVID-19 vaccine pop-up clinics in high-risk neighborhoods, how does the city know that key people in those neighborhoods are not missing these clinics if they're not learning about them until 30 minutes, an hour before they open, as was the case this morning?
So maybe I can start, and Dr. Etch's team in public health has been really piloting this. To be very candid, Josh, we're experimenting. As I said in my opening statement, we know these are the communities that have been the most disproportionately impacted, and we're looking at all different channels. We're literally experimenting of different ways. We're talking about the Infinity Center opening up that center on the weekend, so that's a bit of an experiment. We had pop-ups where we didn't publicize the first 2 days because there's also barriers there when we're for some of these groups, they just don't want people to know. So the objective here is to get people vaccinated and eliminate all the barriers that they may have. And so I know this morning it sounds like we're flip-flopping, but the team at public health said this morning, well, let's ask the media and let's ask maybe some of the councillors to put it out there, because it was a little slower this morning versus what we saw in the other 2 days. So I guess what I'm saying is, for people to bear with us, but they've all have access to all the community clinics that we have through the booking system, so that is available to them. But we want to go past that. We want to innovate. We want to find other ways to allow these people and to eliminate any barriers they may have. And as I said, in some cases, we're even going door to door in high-rise buildings and knocking on doors. So it is a bit of an experimentation. We're kind of pushing the envelope, if I can put it that way. But it's for the reason that we need to get these people to ensure that these disproportionately impacted communities have every opportunity and every availability. So I don't know, Vera, if you want to add anything. I know your team's been piloting this, but it's something that we're going to continue to do, Josh.
Thank you. And my follow-up question, I believe, is also for you, Mr. DeMonte. You said earlier that there were 60,000 appointments available until the end of the month. Any idea if you'll be able to open up more this month as more vaccine rolls in, or is 60,000 all that you'll be able to do this month and you'll start looking into June?
we're ramp up things more, but perhaps if we get more even this month, we will open up more availability. But right now, that's what we have that we've got is confirmed. And I want to remind everybody in Ottawa, we've taken the position not to have what's happened in other communities, vaccine appointments and no confirmed vaccine. So we wait till we get confirmation that we're getting this vaccine and it's pretty solid. And I want to reiterate too, the information we're getting and what we're observing is very positive. We think we're going to start seeing steady flow of vaccine, et cetera. So yeah, Josh, as soon as we hear that we'll have more vaccine, we'll certainly put it up and let people know. But 60,000 is a good amount now, because I know as of tomorrow, a lot more groups are going to go in. I suspect that'll be filled up pretty quickly. And I know there'll be a bit of frustration if that's all we have till the end of the month. But again, this has been our challenge since the beginning, supply and demand far outweighing our supply. But if there's any more vaccine that's made available, it will immediately put on and made available to the public.
Thank you.
Thank you very much. We will now move on to Craig Lord at Global Ottawa.
Thank you. This question would be for Dr. Etches. Dr. Etches, Mr. Christine Elliott said today during question period that the decision to make K2V a provincial hotspot was based on advice from Ottawa Public Health. I'm wondering, what advice specifically did you provide in favor of making K2V a hotspot and not other hard-hit areas like Vanier?
I'm not sure what the minister said. I haven't heard that. There's been ongoing dialogue back and forth with Ottawa Public Health and the ministry about where we see the rates of COVID being higher in Ottawa and why we are using a neighborhood-based approach where it's based not only on high rates of COVID, but also where communities face barriers to getting vaccinated. So we do have ministry support to take the Ottawa approach of focusing on neighborhoods, and that the provincial approach to FSAs is happening. It's concurrent. That's in the provincial booking system, but it's not stopping us from reaching other neighborhoods. And that continues to be our focus, including through mobile and pop-up approaches that will go down to age 18 for people in other areas. And there is overlap with the hotspots, of course, in terms of some of the communities that have been hardest hit. And so we appreciate their increased access on the booking system, and it's complementing our approach.
Yes, but I don't think that there's been any evidence explicitly stated as to why K2V over other potential FSAs that we could have gone with. Is there any evidence that you can speak of, or if there isn't, is that a problem?
I don't have anything in particular that I can add to that conversation. Yeah.
Can I just offer one observation? I think once we're finished with COVID, there'll be a lot of opportunities for all levels of government in the community sector and the private sector to sit down and look at best practices. And one of the things that certainly come to mind with best practices is how do we better coordinate the fact that we have 21 neighborhoods of interest, and then there's 3 provincially. How do we better coordinate all of those communities so that we don't leave some out, or we don't go to one that may not need as much attention because the case rate is lower. So this is a good example, Craig, of what has to be done, I think, after COVID, after we've battled and defeated COVID, figure out how we can better coordinate efforts, because there's a lot of goodwill by all 3 levels of government, but sometimes there is some mixed signals that get out there. So I think that's one of the things I certainly want to work with our staff on in the province and the federal government, well past, we're going to win the battle first before we start doing those kinds of reviews. Thank you.
Thank you both.
Thank you. On va maintenant à Julien Paquette avec le droit.
Oui, ma première question, ce serait probablement pour M. Dimonté, donc je reviendrai sur les 60 000 rendez-vous disponibles d'ici la fin mai. Ce chiffre-là, est-ce que ça permet, dans le fond, d'offrir un rendez-vous à pas mal tout le monde qui devient admissible au cours des prochaines semaines? Ou...
Non, malheureusement, non. Les prochains groupes, avec la plage horaire de large et les travailleurs essentiels, dont les professeurs, entre autres, le nombre est plus grand que 60 000. Ce dit, c'est quand même un chiffre quand même intéressant et un autre bonne plage qui va rentrer dans les gens qui vont au moins avoir une première vaccination dans notre population. Donc, on continue à marcher vers nos objectifs communs. Donc, je crois que c'est positif à cet égard-là. Et comme j'ai indiqué à un de vos collègues, dès que la province nous indique qu'on va avoir si on a d'autres vaccins durant cette période-là, évidemment, on va les rajouter immédiatement. Et ce que je vous dis, c'est que oui, on parle d'ici la fin du mois de mai, mais ce qui semble clair, c'est qu'au mois de juin, juillet, on va commencer à avoir du nombre significatif de vaccins disponibles. Donc, je pense on va éventuellement passer à une étape que la soif que la communauté a, on va être capable de répondre à ce moment-là.
Donc, ça voudrait dire, par exemple, que les travailleurs essentiels qui deviennent admissibles cette semaine et la semaine prochaine, il pourrait y en avoir là-dedans qui n'ont pas de rendez-vous, qui ne leur reste pas de rendez-vous, finalement.
Oui, certains d'entre eux, oui. Qui sont admissibles maintenant à prendre rendez-vous. C'est une question de mathématiques. Si on a 150 000 personnes qui rentrent dans cette plage-là et on n'a que seulement 60 000 rendez-vous disponibles ou possibles à cause du vaccin, il y a des gens qui ne sont pas capables d'avoir un rendez-vous pour l'instant. Mais comme j'indique, je veux être optimiste et positif dans le message parce que ça l'est un message positif. Ce qu'on voit pour le mois de juin est une augmentation significative qui s'en vient du vaccin. Donc, je pense qu'on va commencer à changer la tendance à ce moment-là.
Parfait. Merci beaucoup.
Merci. We will now go to John Willing at the Ottawa Citizen.
Thanks, Seb. Question jumping off the K2V discussion. Are any drop-in and mobile vaccine clinics being planned or have happened or being planned in the future even down the line in the K2V provincially identified hotspot?
Maybe I'll start, and Dr. Arneson, who leads also some of the work that the scientific side of this that's driving this work. So we identify the hotspot priorities based on that, and currently the same tools will be used, or the same tactics as we learn and we experiment with some of these. As I explained to one of your colleagues, we're experimenting and trying to drive through these communities, and we're doing them by hierarchy of priority. So those are most impacted. If there are some, as we continue down the path, that are in that postal code, and Dr. Arneson and his team identified, as we go down from the highest, most impacted, wherever they are, will absolutely, they're not going to be, won't be ignored. We're doing this based on evidence and the science and the data that's in front of us, and that's how the team is targeting those priority neighborhoods based on that. Dr. Arneson, I don't know if you want to add anything to explain a little bit.
Yeah, no, I think it relates to some of the earlier questions. I mean, there's different interventions we can do, different things we can do to boost up rates. And what we're doing this month with the neighborhoods is really taking a close eye and tracking how those rates are going with the different things that we're doing. So the K2V area will, as people know, have the access to the booking system for 18+. So that's one intervention so if we see that the rates are fine there, then that indicates to us that we may not need to go there with a specific clinic or outreach. And then likewise, there may be some other neighborhoods, as Mr. Monte said, that were not identified by the province, but show up in our data as very concerning, and that we've been following all along. We're really watching this closely, almost daily now, looking at this and where we can go. And I think there's the point the mayor made, like there's many different ways to define neighborhoods in public health. And it's a long history of debate about how you define neighborhoods and cutoffs and so forth. But in the end of the day, it doesn't really matter as long as you're looking at all of the different ways we're measuring it and monitoring it, and then putting in place things to help.
Great, thank you for the answer. Second question, maybe I guess Tony, will more administration of second doses pick up as well as more supply comes in, or is there a clear priority to get those first jabs done?
So again, as Dr. Etches often says, this will be driven by the province. What we have been hearing from them is their primary objective is to get as many first doses in the general population done as much as possible. But concurrently and at the same time, I know at the provincial level, and I'll let Dr. Etches talk because it's more with her colleagues that they're looking at that. They're looking at when do we turn the switch on, I guess, for lack of a better term, for the second dose. I know we've extended it to the 4-month, but does that get shortened timeline based on vaccine supply? And what I can tell you locally is the team is tactically looking at what that would mean also with regards to our processes here. So and we may see something run concurrently that people are coming in for first doses, but at the same time, because of the vaccine supply being sufficient, and we diminish the timeline that we start second doses. So you may see that coming, and we're actually the team is actually looking at that strategically to make sure that we're also organized for that. But on the other thing, I don't know, Vera, if you want to add anything to that to help John understand more the.
Well, people are receiving second doses now if they're hitting that 4-month time frame from when they were first immunized. So the point is that most people, it's not until June that we start to see the volume of people who are due for second doses to rise. And so that is being planned for, as Mr. DeMonte said, at the provincial level and the local level. One of the challenges we keep hearing about is that some people have booked or had their first dose through a different booking system. And so they're not able to yet book their second dose in the provincial system, but that will come and there will be a way to do that. And we won't forget about people. So it's part of the planning.
Thank you both.
Thank you. We will now go to Peter Hum at the Ottawa Sun.
Yes, thank you. And good afternoon, everybody. I have a question that I believe is for Mr. DeMonte, and it has to do with a specific business in Ottawa called 613 Lift. This is a gym on Jamie Avenue that has been on the city's radar with respect to the province's emergency order. In early April, the city charged this business twice with respect to operating contrary to the order and with failure to wear a mask. And the newspapers reported on that. Since then, the newspapers are alleging that the gym has continued to open and that there was also an outbreak allegedly at that business. And we've also seen some social media posts that could suggest that the gym might be open. So we've been curious to follow up with the city to see what has been going on with respect to further investigations. We asked about that 2 weeks ago and understood that an investigation was going on. This week, we were told that there were no details to release.
So
to wonder why. So okay. Anyway, I'm looking for an update on with respect to investigations on that business.
Yeah, so I apologize. I think I was speaking over you there for a moment because you were cutting in and out. So yes, unfortunately, there's a stay-at-home order under the provincial rules, and you're correct. That particular business on Jamie Avenue, we had visited several times in the provincial order and charged the director and operator of 613 Lift for not respecting the closure orders. We had great difficulty every time the bylaw would arrive. We actually issued 3 provincial notices. every time the bylaw would arrive, they locked the doors, not let us in, very uncooperative, actually, and in some cases quite belligerent and not violent, but very overtly, aggressive towards our officers. Following that, as you know, Dr. Etches went to the next level in order of Section 22 order and required those businesses. And I can tell you, many of them adapted immediately and followed her instruction to add additional public health measures. Again, this business did not respect those orders, did not let our officers in as the Section 22 requires that we go in to inspect and ensure that the direction from the medical officer of health was being followed. And unfortunately, we've passed to the next step. And I say unfortunately because I think the individual had opportunity to comply. We're talking about a public health crisis that we're in, and that businesses are complying and following the medical advice from our medical officer of health and being part of the solution to the community. As we speak, we are currently at that address right now, ordering a closure order. And giving the individual has 1 hour to close that building and exit everyone from the premises. And you are correct. Unfortunately, there were cases identified coming from that business, and which is even much more frustrating. I know the enforcement side of things, that's our business. But when Ottawa Public Health investigators were going there to do the case tracing and to make sure this doesn't spread in our community, the operator was uncooperative with them as well too. So that is an unacceptable situation. So as we speak, we are now serving an immediate order for closing that premises, and the operator has 1 hour to comply. Police are there assisting us because of the previous history I said. So that's the follow-up as happening right now.
I see. Thank you for that. So just to confirm, because you were cutting it out, was there an outbreak at that premise?
Yes, there were cases that were identified, and when the public health team wanted to go to do what they normally do in all these places, they follow up to make sure that people that may have been exposed and trace follow-ups with those individuals to ensure we don't have more spread in the community. They were not only refused access, but people were uncooperative, so they couldn't complete their very important public health role. On top of the orders that we had given that weren't complied with, and that they were refusing complete entry. So this was not like some of the others. As soon as the Section 22 order that was done, all the others have complied and have followed the public health orders, etc. And I see Dr. Etches perhaps wants to add something.
Just that our practice is to do the investigation, and that's still ongoing.
I see. Can I just ask one last question, because I was not hearing so clearly, but how common is it that you're seeing this kind of recidivism and the workplace is repeatedly violating the pandemic restrictions?
I'm happy to report that it's very uncommon, and I think the results of what we see every time that we have an increase in COVID-19 cases, and Dr. Etches comes out and tells the community is not just individuals. The community are business owners that have been participating and have been doing their part as well too. And as I've said this frequently, this is not enforcement is not going to get us out of COVID. What's going to get us out of COVID is following the public health measures and getting people vaccinated. Enforcement is a tool, and we have to today pass to this. It's unfortunate, but I've also said we won't hesitate to take the necessary steps to protect the community. So it's a very unfortunate circumstance, and it is rare.
Can I just offer a comment, Peter? This is the kind of situation that gets people's blood boiling, because the vast majority of gyms and fitness clubs are following the rules. And you can imagine the number of hours and dollars spent with police, public health, bylaw, going back and forth to this one particular owner. It really is the height of irresponsibility in the midst of a pandemic. And so I appreciate the work that Vera's people and Tony's people have done and conducted themselves with great professionalism. And yet this arrogant attitude that this individual seems to think he's above the law and the pandemic is going to have no bearing on his customers or his staff. And as I said, it also puts the rest of the gym community, which is by and large following the rules, in this position. Why is this guy allowed to open and we're following the rules and we're not allowed to open? So as I said, I think it really is the height of irresponsibility when we're in this battle where literally every day people in our city, or almost every day people in our city, are dying. And he seems to think that he is above the rules and the laws. So, I commend our staff for being professional and perseverance in this very unfortunate situation. Thank you.
Thank you, everybody.
Thank you. On va maintenant à Frédéric Pépin avec Radio-Canada.
Bonjour à vous tous. Ma première question s'adresse à Mme Etches. Alors, Dr. Etches, on sait maintenant que Santé Canada va autoriser la vaccination de gens un peu plus jeunes, de moins de 18 ans, 12 à 18 si je ne me trompe pas. Nous, ce qu'on veut savoir aujourd'hui, c'est est-ce que Santé publique va recommander ou exiger la vaccination des gens de moins de 18 ans qui auront des emplois en contact avec le public? On peut penser peut-être à des camps d'été, là, par exemple. Alors, est-ce que Santé publique va recommander que ces gens-là soient vaccinés avant de pouvoir faire leur emploi?
C'est bonne nouvelle que le vaccin est approuvé pour les jeunes de 12 ans et plus. C'est quelque chose, je pense, c'est important pour la protection de la population et eux. Et la prochaine étape, c'est pour la province de déterminer comment on va inclure cette population dans le programme provincial. Et pour santé publique, on va faire les opérations, les activités de vacciner cette population. Et c'est similaire peut-être que notre approche avec d'autres vaccins pour cet groupe d'âge. Nous faisons un programme chaque année dans les écoles pour d'autres vaccins. On peut utiliser différentes approches comme ça pour ce vaccin. Et on travaille avec d'autres membres de la communauté, les leaders dans le domaine de santé, de soins de santé pour les enfants comme CHIO et les autres. Alors, on verra dans les prochaines semaines, j'imagine, les détails, les directions de la province et les détails on peut mis en place ici.
Merci, Dr. Etches. J'aurais une question pour M. Dimonte. Vous l'avez mentionné en anglais tout à l'heure, mais je voudrais vous entendre là-dessus, M. Dimonte. Ce matin, par exemple, une nouvelle clinique de vaccination éphémère au centre AMA. Là, ce qu'on nous a dit, c'est qu'il y a eu un contact avec les médias à savoir si on pouvait transmettre l'information parce qu'il n'y avait pas autant de gens qui étaient présents. Qu'est-ce qu'il va falloir faire, M. Dimonte, pour ces cliniques-là? Est-ce que vous allez, là, je pense que ce que vous dites, c'est que c'est un projet pilote, mais pour la fin de semaine, par exemple, est-ce qu'on peut prévoir un peu puis l'annoncer, dire aux gens que ça pourrait être une option de vaccination sans rendez-vous 18 ans et plus dans les points chauds de la ville?
Oui, donc ce qui s'est passé, c'est qu'on expérimente, si vous voulez. On veut rentrer dans ces communautés-là où le taux de COVID et l'impact dans ces communautés-là étaient élevés. Et en plus, dans certaines de ces communautés-là, on voit qu'il y a des barrières à vouloir obtenir un vaccin. Donc, l'équipe, quand ils ont développé certaines de leurs stratégies d'expérimentation, basées sur d'autres expériences ailleurs dans le monde, on a tenté les premiers jours à ne pas faire beaucoup de publicité, à parler seulement aux groupes communautaires dans ces endroits-là, aux différents contacts que nous avons. L'équipe de santé publique travaille souvent avec ces communautés-là et donc ils ont des contacts. Et les premières 2 journées, ça a bien été. Ce matin, comme vous avez mentionné, on a fait la même technique et on avait moins de gens qui sont présentés. Et donc, à ce moment-là, on a fait appel aux conseillers de la région, mais aussi aux médias pouvez l'annoncer pour essayer d'augmenter. Donc, l'équipe va partir avec cette information-là et cette expérience-là. Ils vont adapter leur plan pour voir ce qu'il y en est. Je sais qu'on met beaucoup de questions à cet égard-là, mais je vais vous dire, je suis super, je supporte énormément l'équipe qui tente d'expérimenter et trouver des moyens nouvelles pour entrer dans ces communautés-là et pour éliminer les barrières. Et dans certains cas, de l'annoncer publiquement, c'est une barrière. Les gens ne veulent pas se présenter parce qu'ils ont peur ou etc. Donc, c'est vraiment une analyse qui doit être faite sur le terrain et chaque endroit va être un peu différent. Et on est quand même content des résultats qu'on a. Donc, la réponse que je vous donne, c'est que ça va dépendre essentiellement.
Merci, M. Desmonté.
Merci beaucoup. On va maintenant à Catherine Fortin avec TVA Ottawa-Gatineau.
Bonjour, est-ce que vous m'entendez?
Oui.
Oui, dans le fond, la question a déjà été posée à la docteure Verachet en anglais, si c'est possible d'avoir la réponse en français là, concernant les variants indiens. Dans le fond, qu'est-ce qu'on a comme information pour le moment?
Oui, en anglais, on a reconnu qu'il y a 3 cas d'un variant d'intérêt que nous avons confirmé pour les résidents d'Ottawa, mais il y a juste 2 personnes, les 2 personnes qui habitent ici à Ottawa maintenant. Une a resté à Toronto après leur voyage. Les 3 ont une expérience de voyager et les 3 ont fait leur quarantaine. Alors, c'était tous les cas dans la communauté où on a ce résultat. Et pour les 2 à Ottawa, on a aussi l'information que leur contact a fait des dépistages et les résultats sont négatifs aussi. Alors, c'était important de continuer avec les mesures qui protègent et combattre la transmission de la COVID-19, de limiter nos contacts étroits, le port de masque, d'aller dehors plus souvent. Les choses fonctionnent bien contre les variants. Et c'est aussi, on utilise le nom d'un pays, mais ce n'est pas la faute de la pays. On utilise le nombre B1. 617, c'est ce type nouveau et on continue d'apprendre les qualités de cette variante. Il n'y a pas beaucoup d'informations concernant la sévérité, par exemple, le niveau de transmission, si c'est différent, mais la situation dans le pays où il y a le plus grand nombre de cas, c'est vraiment sérieux. Mais on peut utiliser notre outil ici comme la quarantaine pour les voyageurs et c'était efficace d'arrêter la transmission et c'était le cas dans cette situation.
Puis également, est-ce que les vaccins, on a peu d'infos pour le moment, mais est-ce que les vaccins vont quand même fonctionner sur cette nouvelle souche de variant?
Oui, je pense que je comprends, c'est une question d'efficacité de le vaccin. Et pour Ottawa, le variant d'intérêt qui est ici dans la plus grande proportion, c'est B116. C'est efficace. Le vaccin de Pfizer fonctionne bien pour cette variant d'intérêt. Et on continue d'évaluer la situation pour toutes les différentes variantes d'intérêt. Et on va apprendre, mais le plus grand pourcentage de la population qui est vaccinée diminue l'opportunité pour COVID-19 d'être transmise.
Merci.
Merci beaucoup. We will now go to Patrick Uguccioni at Your Community Voice.
So when you get the last question, most of the good questions have already been asked. So I'm going to get a little bit into the weeds with my question. And I'm not sure if it's for Mr. Demonte or Dr. Etches, but there's been some angst online about the qualifications around health conditions. Now, if somebody gets an appointment through the booking system, I think it's the provincial booking system, once they're on site to get their vaccination, will anybody ask for proof of what their health condition is? I've seen some angst online about that.
I can start. So I think the first part of the question, and Dr. Etches can give you more details, the province identified those conditions, and encourage people if they want to look, as I mentioned, go to Ottawa publichealth.ca and you can see those conditions. The objective is that we hope those people who have been waiting and those health conditions do put them at larger risk are able to get their vaccine. On site, the objective is once you arrive, we want a smooth process. And it's not necessarily something that we're going to get into detail. We're assuming these people are responsible individuals and they meet these criteria and they book their appointment accordingly and they'll arrive on site. So no, Pat, we won't be policing that, and we won't get into people's personal health information on the site. The team that are there are registered. If you've got your thing, you register, you'll go through the process. And then when you get to the clinician that's giving you the vaccine, there may be an exchange of information between you and that health professional, which is very normal about, risk factors, et cetera, and they can get into it, but we won't be policing if that's what your question is.
Thank you. And my second question is for Dr. Etches. Again, I wonder if you have any sort of advice or guidance around the issue around AstraZeneca and second doses. What about you sort of mixing and matching with different kinds of vaccines? If you have any advice or
yeah, the second dose. I can say something, but I'll also pass it over to Dr. Arneson, who's more of an expert on all the different vaccines. But the idea is the National Advisory Committee recommends continuing with the series of the vaccine that you have received, and if there's a second dose needed to do that, but it is constantly being evaluated. And so for the latest, I'll pass you over to Dr. Arneson.
Yeah, the latest is we're still waiting, but we're anxiously waiting and monitoring it because it does potentially allow for some different opportunities to get people their second dose. I think, we recognize that there's the mRNA vaccines are very similar in terms of their platform, and the Johnson & Johnson and the AstraZeneca vaccine are very similar to each other in their platform. So I think there'll be recommendations coming on using vaccines of the same platform and also switching between those ones as well. And we're very eager to hear that information. There's nothing yet, but it's certainly of interest to everyone. And I do anticipate that at some point we will be able to have a bit more of an option, but it remains to be studied.
Thank you very much.
Thank you everyone for your time today. Merci tout le monde pour votre temps aujourd'hui. Have a great Wednesday.